Much stronger, much faster, and much deadlier. This is the state of Kashmir Valley amidst the second wave of coronavirus. The first COVID-19 positive case in Kashmir was reported on March 18, 2020. The infection has passed a mark of 1,79,915 in Jammu and Kashmir. Last April, we were here. In the same month this year, J&K reached here. In fact, in just 1 month, from 1st April to 1st May, J&K overall witnessed an approximate increase of 800% in the active positive cases. The percentage increase in the active positive cases in Kashmir alone is the same percent. And the panic has gripped the valley, in which the people are forcing a health crisis along with an infrastructural collapse. This time like never before. Although the government says that there is an adequate oxygen supply, ventilators and essential COVID-19 supplies, viral videos surfacing on the internet are telling a different story. To cater to SOS calls for oxygen and medicinal needs, many NGOs have started to chip in to save lives. People are also curating guides with COVID resources for specific states and utilizing the power of social media in these apocalyptic times. Most of the valley's cases are recorded in Srinagar district of Kashmir, which has also the highest number of containment zones, active positive cases and even deaths. While 150 people died in Kashmir in the last 1 month, 74 of those who died belong to Srinagar district. Experts and many locals believe that the government's push in boosting tourism activities and allowing massive public gatherings despite the surge across the country, that too with a double mutant cases, have contributed to the worsening situation in the valley. As per official figures, travelers, tourists account for 35% COVID-19 infections in JK. Yet, the administration initially ruled out the possibility of imposing a lockdown 3 times in a row and only put partial restrictions. Only after the caseload in the Union Territory went up to 1,69,077 with a higher death toll, the administration imposed an 84-hour-long lockdown on April 29. In 11 districts and in 4 of them, the corona curfew has been further extended. And because the curfew due to the surge is coinciding with the holy month of Ramadan, the Ramadan economy has again taken a hit, as people are keeping it a low affair this year due to pandemic and no longer thronging mosques, shrines and markets. On the other hand, the hospitals remain packed. Doctors, nurses and the entire healthcare fraternity is overworked. SKIMS is witnessing 4 to 5 times rise in the inflow of infected patients at the hospital since March. Most of the beds for the infected patients are occupied. Therefore, in order to cater to the plummeting COVID cases, both SKIMS and SMHs, Kashmir's largest general specialty hospital, have shut down the non-emergency admissions. Worryingly, few media reports and researches are showing that in many states in which the numbers are rapidly climbing up, lower vaccination doses are being administered. In these data charts, we can see that from 48,000 plus average doses per day during the April 1 to 10, vaccination doses in Jammu and Kashmir have reduced to approximately 46,000 per day from April 11 to 20. In the 92 days since the start of the vaccination drive, a total of 15,72,620 people have been administered the COVID vaccine across Jammu and Kashmir. Jammu region accounted for 8,17,920 inoculations, while in Kashmir, the number stood at 7,54,700 as on April 17. Although, in the wake of the recent surge, many people who were earlier hesitant are choosing to get vaccinated. However, due to the exhausted supplies, hundreds of people were being turned away from vaccination centers in the last few days. However, on 1st of May, J&K rolled out the third phase of vaccination drive to cover the people of 18 to 45 age group. As per official data, a total of 1.25 lakh COVID-19 vaccination doses have arrived in Srinagar, which has the highest case load. In the wake of this surge, administration has turned big buildings into COVID-19 centers. However, as Kashmir is gasping for breath like never before, is the demand and supply of oxygen, which experts say is likely to determine the course of the COVID fight back.